Ladies and gentlemen, our top story is coming from the state of Uttar Pradesh, while life-saving blood transfusions have turned into a monumental tragedy. 14 children undergoing blood transfusion have been detected with HIV and hepatitis at a prominent government hospital in Kanpur. Aged between 6 to 16 years, these 14 children were amongst the 180 thalassaemic patients who received blood transfusion every 6 months in the state. Their lives are now at risk. The hospital where these children were detected with HIV and hepatitis have denied any lapses on their part, claiming that the children didn't contract the infection because of the hospital's negligence. They have rather pinned the blame on smaller medical facilities where these children have been receiving transfusion for years now, essentially saying that these kids received transfusions at private and district and in some cases local medical facilities as well when they needed it urgently. And when they visited the Kanpur Medical College for treatment, the infection was detected. Listen in to the doctor who made that disclosure. There has been a U-turn, there is a denial coming in. We'll get you that denial as well. First, listen to what the head of pediatrics of the hospital had said.
जो हमारे यहाँ जो पेशेंट का जो क्यूमुलेटिव डेटा है 8 से 10 साल में, इन बच्चों में से 2 बच्चे, क्योंकि हम लोग इनका रूटीन स्क्रीनिंग कराते हैं हर 3 से 6 माह में, तो ये जो डेटा है आपको जो वहाँ पे प्रकाशित हुआ है, ये पूरा एक्चुअली 10 साल में इतने बच्चे हमारे यहाँ इन्फेक्टेड हुए हैं, जिसमें 2 HIV हैं, 2 हेपेटाइटिस बी और 7-8 के आसपास जो हैं ये हेपेटाइटिस सी से संक्रमित हुए हैं। ये पूरा 10 साल का आंकड़ा है। ये कोई आंकड़ा ये नहीं है कि मतलब 1 महीने के अंदर या 6 महीने के अंदर ये पॉजिटिव हो गए हो। ये लंबे समय का पूरा आंकड़ा है 10 साल में।
Now, despite what Dr. Arun Arya said in clarification, the politics of the transfusion tragedy has given the opposition an opportunity to slam the Yogi Sarkar. Listen in to all that has been said. The Congress and the Samajwadi Party have said that the incident has exposed the sorry state of healthcare in Uttar Pradesh. Congress chief Mallikarjun Kharge has called the episode an unforgivable crime by the BJP. Former Chief Minister Akhilesh Yadav is accusing the government of ruining the state's health infrastructure. But as I said, there is now a clarification and a denial coming from the hospital as well. My colleague Vinod Mishra is joining us on the phone line. Vinod, आपने हॉस्पिटल के आला अधिकारियों से बात की है, वो लोग कह रहे हैं कि पूरी स्टोरी को मिसरिप्रेजेंट किया जा रहा है। ऐसा नहीं है कि ये जो 14 बच्चे हैं जिनको HIV और हेपेटाइटिस सी और हेपेटाइटिस ए डिटेक्ट हुआ है ट्रांसफ्यूजन के बाद, या ये आज या कल में डिटेक्ट हुआ है, ये पिछले 10 साल का आंकड़ा है। जरा बताइए हॉस्पिटल क्या बोल रहा है इस समय?
देखिए, हॉस्पिटल जो है टोटली डिनायल मोड में है, क्योंकि जो खबरें पब्लिश हुई हैं, जो स्टेटमेंट ऑफिशियल डॉक्टर की तरफ से, उनके हॉस्पिटल के डॉक्टर की तरफ से दिया गया है, अब वो उसको डिनाई कर रहे हैं और कह रहे हैं कि उस डॉक्टर के खिलाफ भी कार्रवाई करेंगे। बेसिकली उस डॉक्टर ने भी जो बयान दिया था उसमें बार बार वो पॉइंट कर रहा था कि ये जो आंकड़े हैं ये पिछले 10 सालों के हैं। 2023 है, यानी 2013 से 2023 तक के ये आंकड़े हैं, और इस आंकड़ों में वो करीब जो संख्या वो 14 तक पहुंच रही है। जो डिनाइल के बाद जो प्रेस कॉन्फ्रेंस किया जा रहा है उनके प्रिंसिपल तरफ से, और उनका जो कहना है वो कह रहे हैं कि 2014 में, 2016 में जो आंकड़े आए, और वो भी करीब करीब 7 से 8 आंकड़े गिना रहे हैं। हालांकि वो ये कह रहे हैं कि जो ग्लोबल इंडेक्स है उसमें हमारा सबसे कम है, 1% है ये रेशियो, जिसमें थैलेसीमिया के पेशेंट HIV या हेपेटाइटिस बी या सी से डिटेक्ट होते हैं। तो वो उनका कहना है कि जो ग्लोबल इंडेक्स उसमें हम बहुत कम है, जो आंकड़ा है वो ज्यादा है, विजिलेट किया गया है, और इस पर स्टेटमेंट जिस डॉक्टर ने दिया है उसके खिलाफ कार्रवाई किया जाएगा। बेसिकली इसमें 2 चीजें हैं जिसको बहुत जरूरी है समझना। पहला स्टेटमेंट जो डॉक्टर्स का आता है, जो विभाग को हेड करते हैं, वो बताते हैं कि पिछले 10 सालों में ऐसा आंकड़ा है कि करीब 14 ऐसे पेशेंट है जो थैलेसीमिया पेशेंट है जिनमें डिटेक्ट हुआ है, जो ब्लड के ट्रांसफ्यूजन से, इन्फेक्टेड ब्लड ट्रांसफ्यूजन की वजह से, जिन्हें हेपेटाइटिस बी, हेपेटाइटिस सी और HIV हुआ है। जब प्रिंसिपल खंडन करने के लिए आते हैं, डिनाइल करने के लिए आते हैं, तो वो भी एक आंकड़ा बताते हैं, और वो भी आंकड़ा करीब 5-6 हो जाता है। वो भी कहते हैं 2014 में, 2016 में, 2018 में, 2019 में, 2022 में जो केसेस गिनाते हैं थैलेसीमिया के पेशेंट जिनका HIV पॉजिटिव या फिर हेपेटाइटिस बी और सी पॉजिटिव है, वो भी 5-7 आंकड़ा गिनाते हैं वो भी। तो ये उनका कहना ये कि ये आंकड़ा जो बताया गया है ये ज्यादा बता दिया गया है, ये ऐसा नहीं कि ऐसा हुआ नहीं है। ऐसे पेशेंट जो थैलेसीमिया के पेशेंट हैं वो पॉजिटिव हुए हैं, HIV के वो पॉजिटिव है, हेपेटाइटिस बी और सी के, लेकिन जो फिगर है वो 14 नहीं है, वो कम है, वो 6 और 7 के करीब है, और उनका कहना है कि बहुत कम है, रियली हो जाता है, और इसलिए वो डिनायल में मोड में है, और इसलिए वो कह रहे हैं कि हम उस डॉक्टर के खिलाफ ही कार्रवाई करेंगे जिन्होंने स्टेटमेंट दिया। उनको अधिकारी के स्टेटमेंट देने का कोई अधिकार नहीं है, कि फैक्ट नहीं था, उन्होंने फैक्ट ये दिया है। जी
चलिए, विनोद मिश्रा, आपने हॉस्पिटल की बात हमारे सामने रखी, बहुत बहुत धन्यवाद. इट्स इंपॉर्टेंट फॉर आवर व्यूअर्स टू नो व्हाट इज बीइंग सेड एंड व्हाट इज द डिनायल कमिंग इन. This is what often happens in news. You get a set of information and then a day later, in this case the principal is denying the report exactly 24 hours later. Let me go across to my guests who are joining us this evening. We have Pradeep Mahor, who is leader of the BJP. Dr. Ishwar Gilada is Secretary General of the Organized Medicine Academic Guild, and we have Abbas Haider. He's the national spokesperson of the Samajwadi Party. Gentlemen, thank you very much. Abbas Haider, did the opposition fall to fake news? क्योंकि हॉस्पिटल तो सामने आके बोल रहा है कि ये आंकड़े आजकल के नहीं हैं. These aankras, these numbers that the doctor from the hospital originally put out are for the last 10 years. And if you look at the global average, this is very low. So why is the opposition accusing the BJP government in Uttar Pradesh of completely crushing Uttar Pradesh's medical infrastructure?
Shreya ji, smoke does not come out without any fire, and it is a reality that infected blood has been infused to patients due to medical negligence. And this is not just about Kanpur hospital. We, repeatedly see such cases where, due to medical negligence, children die. Today in Uttar Pradesh, dengue is out of control. There are more than 3 dozen deaths in Uttar Pradesh. First death took place on 2nd of August in Ghaziabad, and it has been almost 3 months. But government has failed to control this menace. I'll tell you, government, their so-called double engine or triple engine government, they control the 17 mayoral seats in Uttar Pradesh, all the Nagar Nigam, they control the state and the union government, but they have failed the citizen of this country on every level. Fogging has not been done by the Nagar Nigam. If you see the condition of state government, what they are doing, there are district hospitals with no medicine, with
Mr. Abbas, I'm not talking about dengue right now.
No,
Mr. Abbas, I'm not talking about dengue now. My focus right now, right now is the transfusion tragedy, where the hospital has come up with a clarification 24 hours later, saying that, the story as is being presented by the opposition is a misrepresentation.
No, I'm
जो
saying
10
that
साल में हुआ है आंकड़ा, 14 children being infected, you are making it sound like it has happened 3 days ago. You're making it sound like it is the fault of the Kanpur government hospital, when it is not. At least this is the version coming in from the hospital.
No, I'm saying that initially they have denied that nothing of that sort has happened. Now they are saying that this has happened, but it has happened in past 10 years. Now they should clarify when has this happened in past 10 years, 6 years, whatever the time period is. I think they should tell us. That's what I asked. And I was focusing on the medical negligence, on the poor medical condition across Uttar Pradesh. I'm not getting into water boundary, but this is a reality. When Samajwadi Party was in power, we have given medical facilities to the poor, to the needy people of the state in 1 rupee. This was done by our government. But why is Bharatiya Janata Party trying to befool the people of the state? This is the valid question they should answer. The problem here is, they talk about Ayushman Bharat scheme, but what has happened in Ayushman Bharat scheme? They have merged many government schemes of the union government, but they have not given, medical facilities to a single patient during COVID time. And now this is a very serious, heinous act of crime which has happened in Kanpur. But I think instead of accepting it, instead of acknowledging it, instead of taking action against people who are guilty, I don't think Bharatiya Janata Party is doing any such thing. Bharatiya Janata Party instead has not given any official statement.
Pradeep Mahor, the charge coming to you, the charge coming against you, that is the BJP and the BJP-led administration in Uttar Pradesh, is that this is a cover-up. That a doctor who has no reason to lie comes out and puts these numbers on our tables. And what the BJP is trying to do now is threatening the doctor who made these claims, and this is a cover.
No, not threatening the doctors. This is something like you're putting words into it. I mean, nobody is threatening the doctors. This doesn't happen in BJP governments. First of all, and we need to understand one thing. the concerned hospital about which we are talking currently discussing, they have just presented a database wherein they are saying that two patients who were suffering from thalassemia, who were undergoing a regular blood transfusion, are currently found to be HIV positive. And this is 10 years database that they are talking about. And there are two patients who are HIV positive, 5 patients who are hepatitis C, and remaining 7 patients are hepatitis B patients, right? So hepatitis B and hepatitis C, there are various sources of these diseases, these viruses, wherein they can be transferred. Second is, as far as the HIV is concerned, first of all, point number 1 is, it is still not known that it is exactly because of the blood transfusion. Second, this is the database that is collected by the hospital itself. Third is that whenever we transfuse blood, there is certain thing that is known as the window period. So if it has happened at all, it is less than the the global ratio, because this is the small ratio of risk that is carried on whenever we transfuse the blood. And as far as thalassemia patients are concerned, who are being regularly transfused with blood, these kind of risks are carried forward. So if we are better than the global ratio, what is the problem? I mean, this is something like Gaga is going on, and we are like adding words to this Gaga. That's it. This is what I can feel personally.
Okay. So did the opposition jump the gun is the question on this story. But the fact is, what cannot be denied is that these children who were coming in for blood transfusion were detected. Whether they were detected pre-2019, post-2019, they have been detected with HIV, they have been detected with hepatitis. That is something, Mr. Mahar, we cannot deny, right? That is something that has happened. The government hospital has detected it. There is nothing to, however, there is nothing to show. I know. I'm saying, however, the hospital is saying, and you are saying there is nothing to show that the government hospital in Kanpur or anywhere else is responsible for what has happened to these children. Dr. Ishwar Gilada, you are the professional on this broadcast. I want to ask you whether you are satisfied with what the principal of the Kanpur government hospital and the BJP spokesperson here are saying, that the numbers that Uttar Pradesh is showing infections because of transfusions, it's lower than the global average, which so yani ki we are okay, we haven't done a bad job. And in any case, these are not recent cases. ये तो पहले की बात है और कहाँ से infection हुआ किसी को पता ही नहीं, so why are you blaming us? Is that the way forward for this debate to take place?
Thank you very much for having me on the show. Having worked even in Uttar Pradesh as an advisor to Governor of Uttar Pradesh between 96 to 98, I happened to start Uttar Pradesh first HIV clinic in 97. At that time, the things were pathetic. Now the things are improved. Coming to technicalities, basically what we must understand, and they also should understand, is the sheer carelessness. This is lack of any responsibility. This is a lack of standard operating procedures. Now, when we know that children or adults with hemophilia, thalassemia, aplastic anemia, they are bound to get blood transfusion often. So the SOP should say that at least once a year they will do the test. If they say that this has happened in 9 or 10 years, then it is again some pathetic thing that you did not diagnose cases for 9 to 10 years. Number 2, out of HIV, hepatitis C and hepatitis B is vaccine preventable. Now, when we know that the children are vulnerable, they will be getting transfusion every month. And even though blood transfusion is checked, they can get a transfusion during window period. So the virus will be there, but the test will be showing negative. In that case, they should have been vaccinated against hepatitis B. So why they are not been vaccinated? It's such a cheap vaccine. You can get in government setup 3 doses for 100 rupees. And these 3 doses will prevent them for whole life. Number 2, hepatitis C is completely curable. So suppose you diagnose them in time, 3 months of treatment can cure them from hepatitis C. And India has been a boon for the whole world that we have been able to give hepatitis C treatment at 0.3% of international cost, which was costing $84,000 per patient for a 3-month course. India gives in $250. So I think we have been careless there also. And HIV, undetectable is untransmittable. So in blood transfusion, if you see HIV is undetectable, it cannot be transfused. What we can do is that to reduce the window period, we can do PCR test or NAT-based test, which can detect virus in just 3 to 7 days. We don't have to wait for 3 months of incubation period. In that sense, in such children, we should have been doing PCR test of the blood or NAT test, and then only blood to be given. So if we have a SOP in place, there is no need of bickering, there is no need of denial. I will give you 2 classical examples of owning responsibility. In France, in 1985, when the first test was made in lab, it was in May 85, and it was commercialized in July. So between this 2-month period, 13 people got infected. After 14 years, that health minister was prosecuted and he was put in jail. In neighboring Germany, in 1985 itself, in July, the tests were made available. But the government decided to have tests only in October. In this 2 months period, some 6 people got infected. Health minister resigned. So we have to own up the responsibility. Who is responsible for giving infection to the children, particularly when our health infrastructure is so bad? So I don't want to go into bickering and politics.
Correct.
But I want to tell them technically that SOP should be in place and there cannot be any carelessness. Own up responsibility.
Okay.
Whereas to children, treat those children which are becoming already HCV positive, they can become negative.
Pradeep Mahor, accountability to will have to be fixed, na? Whether the children have been infected today or 10 years ago or between today and 10 years ago. Someone is responsible for it. When the hospital comes out and says, "Arey, ye to 10 saal mein hua," they're almost brushing it aside saying, you know, it's not happened yesterday. Arey, wo yesterday hua, ya 6 mahine pehle hua, ya it happened 6 years ago. It has happened under your watch. So some amount of accountability will have to be fixed. You know, the principal of the hospital is saying the doctor who came out and made these statements and caused confusion is the one we are going to punish. What about the principal himself? Basic SOPs, like the good doctor is saying, have been flouted. Basic SOPs.
First of all, I heard the doctor. He rightly said that infrastructure facilities have improved. Right. One thing is correct. As far as the SOPs are concerned, first of all, who is saying that SOPs are not followed? I mean, nobody is saying that vaccination has not been done. There are some cases where even after vaccination, people have been infected.
Mr. Mahor, if vaccination was done, why would the children be infected with hepatitis? Mr. Mahor, Mr. Mahor, if agar vaccination hua hota, the kids would not have got hepatitis, na?
Can I complete? Yeah. First of all, there is no such database which is saying that vaccination has not been done. If even after vaccination, these children are infected, I mean, there are some possibilities, there are windows to the vaccination as well, wherein in some cases it has been found, and especially in the patients who are suffering from diseases like thalassemia, wherein they already have lower immune system. So these kind of issues have been found throughout the world. I was reading it through, and it was throughout the world. As the doctor was saying that people are being jailed. People are jailed when there was a mistake. We are probing the matter in case there is something. I mean, it is found.
So if there was no mistake, Mr. Mahor, if there was no mistake, if there was no mistake, would 14 children have been infected with AIDS and hepatitis? Mistake to hai. Ab kiski mistake hai? That is a question that needs to be fixed. Dr. Gilada, I don't have too much time, but Mr. Mahor is saying something which I want to cross-check with a professional. Mr. Mahor, just give me a minute. Dr. Gilada, Mr. Mahor, the BJP spokesperson, essentially is saying that even if there is no data to prove that there is no vaccination for hepatitis in these children, and sometimes it happens that even with vaccination, because these are thalassemia patients, there is a possibility of them getting infected with hepatitis. Is that true? Aisa hota hai?
In 35 years of my professional careers, I have never seen anybody who has been successfully vaccinated against hepatitis B and got hepatitis B. Even if you say that somebody can get hepatitis B infection despite being vaccinated, then whatever number of cases you are getting, that's the worst in the world, because you are saying on one hand that our average is very poor, very low. In last 10 years, only these people got infected. On the other hand, you said that despite being vaccinated, the children got hepatitis B. that means our vaccine is poor quality, which is not. We have been vaccinating, then we should prove that they have been vaccinated. They have not been checked on yearly basis or 6 monthly basis, because in all the hospitals, whenever you are admitting patient, you are doing surgery, you do pre-surgery or pre-admission HIV, hepatitis B, hepatitis C test called triple-H test. Okay, in blood bank you may not be doing often, but you do at least once in 6 months, once in a year, because these are vulnerable children. They can pick up infection, but they are not immunocompromised, as has been said. They are not immunocompromised. They are only having some blood disorder like thalassemia, and they need to be corrected. If you don't correct, then you provide them blood transfusion at a 3 weekly or 1 monthly interval. So in that sense, if they have been vaccinated, they cannot get hepatitis B. Hepatitis C is completely curable. If you did not diagnose for 10 years, there is a mistake. For 10 years, we have a hepatitis C treatment available. You should have diagnosed and you should have treated them. So I think somewhere there is a lack of communication and lack of SOP. We have to own up the responsibility, and most important thing is that we are always about denial, then blame others, then recognition of the problem, then going to the solution. So I think, why don't you go to solution? Why don't you involve professional people, do SOP and do all these things, what is required? It is nothing to do with any party, it is to do with the healthcare system.
Correct. And a mistake has been made. There has been a lapse, because if there was no lapse, children who are going blood transfusion would not have been infected with HIV or hepatitis. So there has been a lapse. Whether this lapse was 10 years ago, 3 months ago, 8 years ago, there has been a lapse, and if you don't fix accountability, Mr. Mahor, then these mistakes will keep happening. Has the opposition jumped the gun? My sense is that they have not done their due diligence. They have not picked up the phone and spoken to local authorities before they started holding press conferences saying double engine, double disease. But that is the nature of Indian politics, ladies and gentlemen. Abbas Haider, you have something to say. I have exactly 10 seconds, no more than that. Go ahead.
Dr. Gilada has professionally explained the situation, but let me tell you the only standard operating procedure that Bharatiya Janata Party and UP government follow, that is brush off things, try to hide things.
Standard procedures are followed by Bharatiya Janata Party government. What is he saying?
This thing has happened is a very sensitive issue. It has happened 6 years back, 10 years back, 20 years, doesn't matter. Why are you not taking action against the people who are guilty? That's my only question. And Bharatiya Janata Party leader, I hope they don't start treating patients, because he was trying to portray
it is a medical fraternity. You have to follow the procedures.
Gilada has explained that it has nothing to do with that. If proper vaccination would have been provided to those children, I think the situation would have not been gone haywire like it has happened. So I think Bharatiya Janata Party should focus. They should not just try to put both at district hospital as they are portray themselves as medical colleges. This cannot happen anymore. Like we have seen during the time of COVID, they have said that nobody died due to shortage of oxygen. UP government was taking action against people who are saying we don't have oxygen instead of providing oxygen. So this is what the standard operating procedure of UP government is.
Okay, we'll leave it there for the moment. We have put out all sides of the story. As journalists, that's our job. We got the spokespersons of the two parties. We've got a professional, Dr. Gilada, on the show. We've shown you what the doctor originally who had made these claims has said and what the principal of the hospital is saying. So, ladies and gentlemen, all versions in front of you. I'll let all of you decide on what stand you want to take on the story. We'll leave it there for the moment. Pradeep Mahor, thank you very much. Dr. Gilada, always good to have you on the show. And Abbas Haider, thank you very much for joining us as well. I'm stepping into a very quick break on the show. There's much more on the other side. Do stay with us.